Hi friends, I'm Dr.Priti Vyas and I'm going to talk to you today about cervical cancer. What is cancer? It is the growth of abnormal cells which actually land up replacing the normal cells, taking over the function of the normal tissue, not allowing the normal tissues and the normal cells to do their activities, and eventually killing the normal tissue. When we talk about cervical cancer, we talk about the mouth of the uterus, the cervix. How does this happen? It happens because of a simple virus. Can you imagine? A small little virus can create so much havoc in a woman's life. The virus is called HPV, human papilloma virus. This virus is sexually transmitted. Of course, there are other ways of transmission of this virus too, but main mode of transmission is sexual. When a woman gets infected with this virus, she will have no signs, no symptoms. There is no discharge, no burning, nothing at all. But the virus would get lodged into the cervix, the lining of the cervix, and it would remain there for a lot of years, sometimes even for 12 years, 14 years, before it actually starts showing anything at all. What happens is that slowly it percolates into the lining of the cervix, and the patient, the person, becomes a carrier and also lands up infecting others who come in contact with her. This virus causes not only cervical cancer and precancerous changes in the cervix, but can also cause warts in the vulva, the vagina, or even the oral epithelium of the mouth. The good news is it has such a long life before it actually lands up causing damage. That's the time when we can pick up an infection. The best thing to do is prevent it. How do we prevent it? Two ways. One, make sure that there is safe sex. Make sure that a barrier is used as a mode of contraception so that the virus cannot land up infecting the woman in the first place. Also, there is a way to prevent even before an infection would set in, and that is by giving vaccinations. There are vaccines available to help prevent this infection and to help protect a girl, a woman, from this infection. The ideal time to take this vaccine is before a person gets sexually active. So, 9 to 19-year-old girls have to be vaccinated before they decide to become sexually active. And of course, for the older age group, once they are sexually active, they have to do the regular cytological testing. It's called as a pap smear. It takes less than 5 minutes to do the test. It is painless. It is absolutely easily done in the consulting room of a gynecologist. And the result would come in just less than 3 days' time. But this would help detect any kind of changes in the cervix well before any cancerous changes would happen and would help to protect the women. It's important that we pledge to protect the women of India. Friends, I would tell you all, take a pledge to protect the girls, to protect the women of India against cervical cancer. Let's spread the awareness, make sure we vaccinate our girls, and make sure every woman undergoes a pap smear testing. Thank you. So next time I see you again with some more tips. We'll talk to you about ectopic pregnancy. If you like our video, please subscribe, like and share our videos. And if you want, you can press the bell button that will help you to get the fresh updates every week.